This video is for anyone who's considering their options between surgery and a non-surgical approach. In this video, it's a non-surgical approach. And this is about 1 year in the life of my dog since her injury, and I hope you find it helpful and useful on and off for a few months before the actual injury. I did notice that she was favoring the leg at times, limping a little bit. It would get a little better, and then I would notice it happening again. And then one day in early March 2016, she was running around the yard. I wasn't watching her, but I heard a sharp yelp and she came running and hobbling on 3 legs. And pretty much, this was what she was like for the next few days. Not wanting to touch that foot to the ground hardly at all, the vet confirmed it was a full tear. They did that drawer test where they manipulate the joint. And judging by the level of pain, and also the fact that it was on and off leading up to this, that she was limping like getting better. No long walks or anything strenuous, no running around. That type of thing. I probably should mention the age. She's about 9 o'clock or 10 o'clock when this happened. I wasn't exactly sure what level to take the rest to. I wasn't aware, whether that meant just, no running around or wet. Whether what it was dark, so I kind of continued to do short walks on the street. But I live in a hilly area, and so that generally meant at some point we were going to have to climb a hill, even if we went just short bathroom breaks. Finally, about a month later, that wasn't seeing any improvement, and then I found this website. I believe it's pronounced diggerpaws.com. There is a wealth of information on this site, all about this injury, and I found it to be instrumental in the recovery of my dog. I stopped taking her on the hilly streets for her bathroom breaks, and I instead switched it to just shortly strolls in the yard, just until she would pee or poop, and then I'll bring her back inside. Try to keep her in one room. Sometimes I would fence off that room if I had to leave because she would follow me. And I even put a sign on the front door asking people not to ring or knock unless it was necessary dark, so that really helped a lot. I started sleeping downstairs as well, so that she wouldn't have to go up the stairs at night. So this was originally injury from early March, and now it's about the end of April that I started to notice. She would put a little weight on that bad leg and just went walking, but she would still hold it up in the air when she stood. But then shortly after that, she seemed to have some kind of setback in her recovery. This is when I sort of made it up in my mind that I would take her to an orthopedic specialist to get another opinion. Just before her appointment was coming up for this specialist, it was about maybe a week or so later. I did notice she did get a little bit better and was using that leg a little more. But I still decided to keep the appointment just to take her, and I kind of felt like I needed another opinion. The specialist manipulated her joint again, and I later read on tickerpaws.com that this is not a good thing to do when the dog is already under recovery, and definitely gave her a pretty major setback.